Before you skip this video, I need you to hear this, because what I'm about to tell you might save you years of pain. As a doctor, I've seen people walk into my clinic with lower back pain, hip problems, and nerve issues they never expected to have. They exercised. They felt healthy. They did nothing wrong, or so they thought. But when we traced the real cause, almost every one of them was shocked. One very common habit, that is done the wrong way, was quietly damaging their body. Today, I am going to explain why you need to stop doing doggy style like this. It's not to scare you, but to protect your spine, your hips, and your long-term health. If you've ever felt pain, stiffness, or discomfort afterward, or if you want to make sure you never do, you need to watch this video till the very end. I want you to listen very carefully, because what I'm about to say might make you uncomfortable. Something that feels normal, something many people assume is harmless, is quietly sending thousands of people to hospitals every year. Lower back pain, hip damage, nerve compression, pelvic floor dysfunction. And most of them never connect it to the real cause. As a doctor, I've reviewed scans, MRI results, X-rays, and again, the same pattern appears. That's why today, I have to say this clearly. Stop doing doggy style like this. Not because intimacy is wrong, but because doing it incorrectly can slowly destroy your body. This video is not about embarrassment. It's not about morality. And it's definitely not about judging anyone. This is about human anatomy, biomechanics, and long-term health. If you've ever experienced a lower back pain after intimacy, hip tightness, pelvic discomfort, numbness or tingling, or stiffness that lasts for days, this video is for you. And even if you feel fine now, what you're about to learn could prevent serious problems in the future. Why doctors are seeing more cases than ever. 20 years ago, cases related to intimacy-related musculoskeletal injuries were rare. Today, they are no longer uncommon. What changed? 1. Sedentary lifestyles. 2. Weak core muscles. 3. Poor posture from phone and desk use. 4. Lack of body awareness. 5. Copying unrealistic positions seen online. The human body did not evolve for prolonged stress in awkward angles, especially when stabilizing muscles are weak. The spine, what most people get wrong. The spine is not a straight rod. Your spine has natural curves. These curves are shock absorbers. When you excessively arch the lower back repeatedly, you compress the lumbar discs. What happens over time? Disc dehydration, micro tears, nerve irritation, sciatic pain, chronic stiffness. One bad movement won't destroy your spine, but repeated strain over months or years absolutely can. The hips and pelvis silent damage zone. The hips are among the strongest joints in the body, but strength does not equal invincibility. Common issues doctors see: hip impingement, labral strain, pelvic misalignment, sacroiliac joint stress. When the pelvis is forced into unnatural tilt without support, surrounding muscles compensate, and compensation always leads to injury. The most common mistakes, medical view. Mistake number 1, overarching the lower back. People mistake extreme arching for better positioning. Medically, it's one of the worst things you can do. Mistake number 2, ignoring discomfort. Pain is not passion. Pain is a warning signal. Mistake number 3, no core engagement. A relaxed core equals unstable spine. Mistake number 4, poor surface support. Soft or uneven surfaces increase joint stress. Warning signs you should never ignore. Your body always speaks before it breaks. Stop immediately if you experience sharp pain, burning sensation, tingling or numbness, sudden weakness, pain lasting more than 24 hours. These are not normal. These are red flags. Why this affects both men and women differently. For women, pelvic floor strain, hip instability, lower back overload. For men, lumbar compression, hip flexor strain, nerve irritation. Different anatomy, same risk, improper alignment. The psychological side nobody talks about. When pain appears, many people push through it out of fear of ruining the moment. This creates a dangerous habit, ignoring bodily signals. Healthy intimacy should never require self-harm. What healthy intimacy should feel like? You should feel relaxed, supported, Connected, comfortable afterward, not injured, not stiff, not worried. In the next part of this series, I'll show you how to protect your spine, how to reduce pelvic stress, and how small adjustments can prevent years of pain. Because prevention is always better than treatment. If this information already surprised you, stay with us because we're just getting started. Hi, I'm Dr. Dixon. You are welcome back at InfoHub today. If it's your first time coming across our channel, hit that subscribe button to stay tuned. In the first part of this video, we talked about why doctors are seeing more injuries than ever before. We covered the spine, the hips, the pelvis, and the warning signs your body gives you before serious damage happens. Now in this part, we're going deeper into how the body actually moves and why small mistakes lead to big consequences. Biomechanics, how the body handles stress. The human body is designed to move efficiently when forces are distributed evenly. Problems begin when force concentrates in one area. Key principle doctors use: load plus angle plus repetition equals injury risk. Load, body weight, and pressure. Angle, joint, and spinal positioning. Repetition, frequency over time. You may not feel damage immediately. Most injuries are cumulative. Why the lower back takes the biggest hit. The lumbar spine's job: supports upper body, transfers force to hips, stabilizes movement. When the lumbar spine is forced into excessive curvature repeatedly, it becomes the weakest link. What doctors see on imaging: disc bulging, facet joint irritation, muscle spasms, inflammation around nerves. Many patients are shocked when scans reveal damage they never associated with intimacy. Hip flexors, the hidden problem muscle. The hip flexors connect your spine to your legs. When they tighten excessively, they pull the pelvis forward, creating an exaggerated arch in the lower back. Result: increased lumbar pressure, reduced hip mobility, faster fatigue, pain during and after activity. Tight hip flexors are one of the most overlooked causes of lower back pain. Posture carries over into intimacy. If you sit all day with poor posture, your body doesn't magically reset. Common modern posture issues: anterior pelvic tilt, rounded shoulders, weak core stabilizers, inactive glute muscles. These patterns follow you into every movement, including intimacy. Why copying online content is dangerous. Many people unknowingly copy exaggerated movements seen in media. These positions are designed for appearance, not safety. Medical reality. Cameras hide discomfort. Editing hides strain. Bodies on screen are often trained, flexible, and conditioned. Trying to replicate those angles without preparation is like attempting a professional athletic move without training. Pelvic floor, the most misunderstood system. The pelvic floor is not just a muscle, it's a system. Its roles: supports organs, stabilizes the spine, controls pressure. Overstretching or overloading this system can lead to long-term dysfunction. Common consequences: pressure sensations, weakness, reduced control, chronic discomfort. Once injured, the pelvic floor takes time and patience to heal. Core engagement, what doctors actually mean. When doctors say engage your core, they don't mean tensing everything. Proper engagement: gentle abdominal activation, stable breathing, neutral spine awareness. Think support, not stiffness. Pain versus pressure, know the difference. Not all sensations are equal. Acceptable: mild muscular effort, temporary fatigue. Not acceptable: sharp pain, burning, tingling, numbness, joint locking. Your nervous system does not lie. Why ignoring pain creates long-term damage. Pain ignored becomes adaptation. Adaptation becomes compensation. Compensation becomes injury. And injury becomes chronic. This cycle is responsible for many cases of lifelong lower back pain. Small adjustments, big difference. You don't need extreme changes to protect your body. Doctor-approved principles: maintain neutral alignment, reduce excessive angles, add support where needed, move slowly and intentionally, stop at discomfort, not after pain. Safety is not boring. Safety is sustainable. Why communication is medically important. From a health perspective, communication prevents injury. Ignoring discomfort to push through is one of the fastest ways to get hurt. Your body deserves respect even in moments of intimacy. In the next part, I'll show you doctor-recommended safe positioning principles, how to protect your spine step by step, and how to recognize when your body needs rest. Because real confidence comes from control, not recklessness. If this information is changing how you think about your body, stay with us. This series could save you years of pain. So far in this series, we've talked about why injuries happen, how the spine and pelvis are affected, and why modern posture makes the body more vulnerable. Now it's time to move into solutions, real, medical, practical solutions. This is where prevention replaces pain. The golden rule, neutral alignment. In medicine, neutral alignment is the safest position for almost every joint. What neutral means: the spine maintains its natural curves. The pelvis is not excessively tilted. Muscles support joints evenly. No area is forced beyond its range. Neutral doesn't mean rigid. It means balanced. Why extreme angles are the real problem. Most injuries do not come from movement. They come from excessive angles held under load. What doctors see: compressed discs, overstretched ligaments, inflamed joints. The more extreme the angle, the greater the stress on soft tissues. Doctor-approved adjustment principles. Principle number 1, reduce lower back arch. A slight curve is healthy. Extreme arching is not. Principle number 2, support the pelvis. Support reduces muscle overwork. Principle number 3, keep movements controlled. Speed increases force. Control reduces injury. Principle number 4, engage. Don't tense. Supportive muscles should assist, not dominate. Why surface support matters more than you think. Soft or unstable surfaces change how force travels through the body. Medical reality: too soft equals joints sink and strain. Too unstable equals muscles fatigue faster. Your body needs predictable support to stay safe. The role of the glutes, often ignored. The glute muscles are powerful stabilizers. When they're weak, the lower back compensates. The hips lose control. The pelvis becomes unstable. Strong glutes protect the spine. Breathing, the stability tool nobody uses. Breathing is not just for oxygen, it stabilizes the spine. Proper breathing: slow, controlled, diaphragmatic. Holding your breath increases pressure and tension. Why pushing through is a medical mistake. Pain tolerance is not strength. From a clinical standpoint, pushing through pain increases inflammation and delays healing. The body heals best when respected, not challenged beyond limits. How small misalignments become big problems. A few degrees off may not feel dangerous, but repetition turns small misalignments into chronic injuries. Common long-term outcomes: persistent stiffness, reduced mobility, nerve sensitivity, pain flare-ups during normal activity. Most chronic pain starts quietly. Listening to your body, clinical skill. Patients who recover fastest are those who listen early. Early signals: tightness, mild discomfort, uneven fatigue. Early signals are invitations to adjust, not ignore. When rest is medically necessary, rest is not weakness. Pain lasting more than 24 to 48 hours means tissues need recovery time. Ignoring this leads to inflammation stacking, building a body that handles stress safely. Injury prevention doesn't start in the moment, it starts in daily life. Doctor-recommended focus: core strength, hip mobility, posture correction, regular stretching, adequate recovery. Your body adapts to how you treat it. Why age doesn't protect you. Younger bodies feel pain later, not less. Older bodies feel pain sooner, but heal slower. No age group is immune. In the next part, I'll explain how long-term damage develops, what doctors see in chronic cases, and how to reverse early-stage problems safely. Because once pain becomes chronic, prevention turns into treatment. If this information is helping you understand your body better, stay with us. This knowledge can change how you move for life. So far, we have talked about alignment, biomechanics, posture, and how small mistakes create stress. Now we're going to talk about what happens when those mistakes are repeated for months or years. This is where temporary discomfort turns into chronic damage. How acute strain becomes chronic pain. Most chronic pain does not start with a single injury. It starts with repeated microtrauma. The medical progression: mild strain, inflammation, tissue compensation, altered movement patterns. Chronic pain: by the time patients seek help, the original cause is often forgotten. What doctors see on MRI and X-rays. When patients finally get imaging, the results are often surprising. Common findings: disc bulges, facet joint irritation, muscle imbalance, pelvic asymmetry, nerve root inflammation. Many of these changes develop silently. Pain appears after damage, not during it. The sacroiliac joint, a major pain source. The sacroiliac joint connects the spine to the pelvis. It's strong but not designed for repeated shear stress. When it's irritated, pain radiates into hips. Stiffness appears after rest. Movement feels uneven. SI joint dysfunction is commonly misdiagnosed. Pelvic floor dysfunction, long-term effects. When the pelvic floor is overstressed repeatedly, it loses coordination. Possible outcomes: pressure sensations, fatigue, reduced stability, chronic discomfort. These issues are treatable, but early detection matters. Why pain shows up later, not immediately? The nervous system adapts. It dampens signals until tissue damage crosses a threshold. That's why many patients say, "I was fine," until suddenly I wasn't. Red flags that suggest chronic problems. Warning signs: pain that returns repeatedly. Morning stiffness lasting over 30 minutes. Pain triggered by everyday activities. Discomfort during rest. Uneven movement or posture. These are signs your body has adapted incorrectly. Early stage reversal, doctor approved. The good news is, early damage can often be reversed. Medical focus areas: reducing inflammation, restoring alignment, re-educating movement, strengthening stabilizers. Pain relief without correction only delays the problem. Why medication alone is not the solution. Painkillers reduce symptoms, not causes. If mechanics remain faulty, damage continues. That's why long-term relief requires movement correction. Physical therapy principles doctors use. Core elements: postural retraining, controlled mobility, strength balance, nervous system regulation. Recovery is not about doing more, it's about doing better. Lifestyle changes that protect your body. Your spine doesn't reset overnight. Protective habits: better sitting posture, regular mobility work, strength maintenance, recovery days, listening to discomfort early. Health is cumulative. The emotional side of chronic pain. Chronic pain changes behavior. People become fearful of movement. Education restores confidence. Understanding your body removes fear. When to see a doctor. Seek medical advice if pain lasts longer than 2 weeks, worsens over time, radiates, affects daily life. Early care prevents long-term disability. In the next and final part of this series, I'll explain how to maintain long-term spinal health, daily habits that prevent recurrence, and how to move with confidence and safety going forward, because knowledge without action doesn't protect you. If this series is helping you understand your body differently, stay with us. Your future self will thank you. At this point in the series, you now understand something most people never learn. You understand that pain doesn't come from intimacy itself. It comes from how the body is positioned, supported, and respected. You've seen how small mistakes add up, how ignoring discomfort leads to chronic damage, and how alignment can either protect or destroy your spine over time. Now let's talk about how to make sure these problems never come back. The long-term spinal health framework. Doctors don't think in moments. We think in years. Long-term spinal health depends on 3 pillars. Pillar 1, alignment awareness. Know your neutral spine. Avoid extreme angles. Adjust early, not late. Awareness alone prevents many injuries. Pillar 2, strength where it matters. Core stability, hip strength, glute activation. Strong stabilizers protect vulnerable joints. Pillar 3, recovery and respect. Rest when needed. Stretch regularly. Stop before pain escalates. Recovery is part of strength, not the opposite. Daily habits that protect your body. What you do outside intimate moments matters just as much. Doctor-recommended habits. Avoid prolonged sitting without breaks. Stretch hips daily. Maintain good posture. Strengthen core 2 to 3 times per week. Sleep with proper spinal support. Your spine remembers how you treat it every day. Why consistency beats intensity. Doing a little consistently is better than doing a lot occasionally. Most injuries come from sudden overload, not gradual conditioning. Slow improvement keeps tissues healthy. Confidence comes from control. Real confidence is not pushing limits blindly. Real confidence is knowing when to adjust. When you understand your body, fear disappears. What to do if you've already had pain? If you've experienced pain before, don't panic. Medical advice: reduce aggravating movements. Focus on alignment. Strengthen weak areas. Seek professional help if pain persists. Early correction prevents permanent damage. Why education is the best medicine. Most patients I see say the same thing. I wish I had known this earlier. That's why this video exists. The bigger message about body respect. Your body is not replaceable. Pain doesn't make you stronger. Ignoring discomfort doesn't make you brave. Listening to your body makes you smart. If something consistently causes pain, it is not sustainable. No moment is worth long-term injury. Healthy intimacy should leave you relaxed, comfortable, and connected. Not sore, not injured, not worried. You deserve better than silent damage. If you found this video helpful, please give it a thumbs up and subscribe to our YouTube channel at InfoHub Today to stay tuned for more health tips. You can also check InfoHub Today verified store from the link beneath this video. We always appreciate your patronage. Thanks for watching. Stay safe.